Ja, men då så. Då säger jag hej och välkomna. Trevligt att ni har kommit hit till denna medlemsträff med Stroke Landsföreningen i Uppsala. Jag ska berätta lite kort här om upplägget för ikväll. Och senare ska jag lämna över till Per som presenterar vår hedersgäst idag, Raoul Vasa. Men jag ska berätta lite kort först här om våra medlemsträffar. Vi brukar ha ett upplägg där vi först har en gäst som pratar ungefär 30 minuter. Sen har vi ungefär 30 minuter då vi har svar och frågor. Och sen efter det har vi de som vill, kan och vill få stanna och mingla lite, så pratar vi och diskuterar lite allmänt.
Med fika.
Ja, precis. Och det kan jag berätta, det kostar ingenting, men vi har fika här. Och vill man ha fika kostar det 20 kronor. Och det finns en burk som man kan lägga i bara. Och det går det. Men nu ska vi ha det här. Jag kan också berätta om att dels att vi har ett nyhetsblad med vårt vårdprogram här. Som ni gärna får ta sen. Finns här. Sen har Per gjort lite ordförklaringar också. Som du vill presentera själv, som vi kan skicka runt till de som vill ha.
Mm. Förhoppningsvis är det rätt, vi får se.
Ja, jag hoppas det.
Och jag faktagranskat det.
Ja, precis.
Per, du får presentera Raoul.
Ja.
Välkomna i alla fall.
Thank you.
And welcome you.
Thank you.
Yes.
Ja, allihopa. Jag heter Per och jag är styrelseledamot i Strokeföreningen. Jag kom med i våras, för snart ett år sedan, av Finn som ledde mig. Och det var väl mycket för att jag är nyfiken och tycker om att fixa och lösa saker. Så när han presenterade saker så kom jag på, det här kan jag göra, det här kan jag göra. Så att det är väl grunden till att jag kom in i föreningen. Och jag är väldigt nyfiken av och eventuellt förhoppningsvis kanske börja forska senare. Och då vill man gärna forska om någonting som är reellt och viktigt. Så därför så är föreningen också ett sätt för mig att få en inblick i hur verkligheten ser ut för många patienter. Därför är jag här. Och nu är det så att vi har fått in en hedersgäst, henne från Indien, Raoul Vasa.
Guest of honor.
Guest of honor. Och hon kommer från Indien. Hon gick färdigt, vad kan man säga, post-education, vet man översätter det.
Ja, fortbildning.
Fortbildning eller sin doktorering i Schweiz.
Fördjupning.
Fördjupning i Schweiz. Och hennes passion, vad jag förstått det, påminner om mig. Vi är ganska lika, har jag märkt. Också väldigt nyfiken. Hon kom ut och märkte att det var väldigt få som visste hur man skulle hantera strokepatienter och de som har lesioner eller skador på hjärna och ryggmärg. Så det blev hennes kall att försöka, hon blev nästan besatt av det, att försöka lösa det här och leta över hela världen efter lösningar. Så, för att presentera då, Dr. Raoul Vasa. Välkommen.
Vi kan väl säga det, Gunilla Frykberg heter jag. Jag tror jag träffade flera av er då 27 oktober när Nikolaj var här och berättade. Så att jag hjälper till lite grann, och om ni har frågor så bara ställ dem på svenska så kan jag översätta about questions. That they can put questions, I will translate. Så översätter jag så att...
tillsammans så ni vet mycket väl.
And just a short information for you, Rajul. Finn just said 30 minutes of presentation and then 30 minutes for questions. So, okay.
And then we have, we can eat and we can talk individually.
Oh, sure.
That's a plan, roughly.
Very good.
Yeah.
Today in India, it is a Republic Day, the 26th January. Can you imagine? And I'm here on the 26th January, the Republic Day in Uppsala. So it's, I think, an important day when we are here at the Stroke Organization. And before I start telling you how in my mind for the patients a new thinking began, how my journey began towards thinking differently before I started a Vasa concept in reality. I started seeing the patients coming in our hospital, and I was too junior, maybe just 6 months of my practice, and my mentors, my teachers, our bosses, they were treating stroke patients. And I was just looking, and I was just saying that, oh, the patients are coming with their problem, and they want that we should cure them and make them all right like before. So I asked questions to my teachers, what are you doing? Because what we were doing was just the passive movement, or we were trying to teach them to walk in the parallel bar. So they were holding on to one bar, and then they were using their good leg, and they were walking. And our bosses were happy. Oh, patient is already walking. But I said that is not the way the patient would like to walk when he goes back home, because he wants that his leg gets all right and his arm gets all right. Another thing that I saw, that therapists were treating for the leg and the occupational therapists were treating for the arm. So there was kind of a division between the upper body and the lower body. So that also made me think that when we are doing all the activities, like I pick up a glass of water, I look at, pair, drink, talk, walk. So our whole body works as one integrated whole. There is no division between the right and the left. But what we were doing with our patients were, at that time, I had all these questions, but I didn't have any answer, and nobody was giving me any answer. So I said, there is something which is not meeting our eyes because it is not explicit. And I just said that there is something which is implicit, but I don't know. So I thought maybe people in the whole world know about it. So I tried to go for my studies outside, and then I tried to travel around the world. And I asked them questions, and nobody has answers. So I realized that everybody is putting the arrow in the dark. And if it works, if it hits, it hits. If it doesn't hit, doesn't hit. So the question that came to my mind, the first initial question, that we have half the brain working for this body, half the brain for this body. And when there is a lesion in the brain, do you know how big is the size of the lesion in the brain? Maybe the size of sometimes a small rice, sometimes maybe a peanut, but not bigger than that. Sometimes in a very bad lesion, little bigger than that. So that little point, it cannot give half side of my body to get paralyzed. But that's the fact, that half the side of the body is paralyzed. Then the more questions were coming to my mind, that in the brain, if you look at Uppsala, then Uppsala has north, south, east, west, center. Similarly in our brain, the lesion could be in the north, south, east, west, in the middle, little below. It could be anywhere. But the picture that we see is again one side of the body paralyzed. And how we are brought up, we are made to think that every little area of the brain has got a specific function. So if north has a specific function, only that should be lost. If south has a specific function, only that should be lost. But here what you see is whole entire one side is lost. And when the patients were coming to us, what we were trying to teach them is to relearn to live their life using their good body. Hold on to parallel bar, hold on to the stick. Of course, Mr. Finn don't hold the stick, but initially you must be holding the stick. And what you learn is to compensate, that you use your good side most of the time and you avoid the left side. So you are not integrating your both sides in your life, in your day-to-day life. So these were many, many questions. I asked all these questions to my mentors, my teachers, people around the world, and the only answer which I got was, Rajul, don't you understand? There is a lesion in the brain. So what we have all the time learned is that the descending neural pathways which go from brain to the muscle, they are like disrupted or kaput or not working. And therefore the whole one side is not working. Anyway, so the questions kept coming to my mind and things kept rolling in my head, and I was restless and absolutely kind of what to do and how to do. Before what to do and how to do, I will show you a film of what is going on in the world in last 100 years. For example, I'll start with Woodrow Wilson.
Jag är i vägen för någon. Nu sitter jag rakt i vägen för dig.
You know, I have a little pain in the knee. I got an injury last week in Olan. So I'm not very comfortable running with my knee. Okay, here is Mr. Woodrow Wilson. You see him. That he is signing on the paper, on the document. And he cannot support the paper with his left hand. And his wife is supporting the paper while he is signing. He's got a stroke on the left side. And on the second picture, you see he's holding on to the stick. And he is bending his body. So his trunk, there is a disparity between the right trunk and the left trunk. Then you see here, again, stick in the hand and the arm is going in this posture. Again, stick in the hand and he is looking down because he feels very safe looking down instead of looking straight ahead. Here is, so that was 1919, and now here is 2012. Everyone is open to see the picture before I speak. You can guess what I'm trying to indicate?
Someone that's not using the stick.
He's using the stick.
Yes.
There is no difference.
There is
Oh,
no
okay, okay.
difference. That's
Like
what
this.
I want to convey.
Okay.
What I want to convey is that in 100 years, what has changed? And all these, he's Mr. Senator Kirk. He's from USA, from Chicago. And 1 year he was in the rehab center with all the modern treatment, which will come in the next movie. But this is just to make a comparison that in 1919, what was the state of Woodrow Wilson, is the same state of this gentleman in 2012. And now he's with Obama, and you see he has got a stick in his hand when he is in the picture with Obama. You don't see the stick, but he has that stick in the hand. And his hand is up. He's using the wheelchair. Now, the question here is, if he's going to use the wheelchair for transportation, he was made to walk on the treadmill with the corset, which you will see in the next films, not now. That at the end of training to walk on the treadmill, 1,000 kilometers, so no, he was there for 1 year in the whole, for the treatment, and every day he was made to walk more than 15 kilometers. So he walked throughout the year, every day 15 kilometers, so that it could have been more than 500 kilometers. Yeah. And at the end of training for so long, he is in the wheelchair. Do you see that? So does he go for the treatment to this modern rehab center to sit in the wheelchair? Or he would like to be independent? Yeah? Next. Here is Mr. Andrew Marr. He is a BBC journalist, and he got a stroke in 2013. And you see what is the status? He is quick to pick up Mr. Pear. It's the same state. Yeah. Next. This is Gabriella Gifford. No, Gabby Gifford or Gabriella Gifford. She is a representative in U.S. Senate. And you see, she has had a stroke on the left side, and she's holding onto the stick on her right side. She's wearing the splint in the hand. She's got the shoulder sling in the hand, in the one below, and she's going for rifle training with her left hand, with her right hand, and she has got the suspension sling for her subluxation. You see that pair?
Yes.
Next.
There's something wrong with left and right here in the pictures.
Yeah.
De har alltså förväxlat på något vis.
Because they are
spegelvända
opposite.
bilderna.
Because these pictures are picked up from the internet, so you know. And all of you know this Mr. Thomas Transtromer. He was rather from Stockholm, the poet and a literature and a Nobel Prize winner. And he got a stroke in 1990, and he died in 2015. So he lived 25 years after stroke, but he could not speak. He was aphasic. He was right side hemiplegic. And do you see his hand? And he's also holding onto the stick, and his hand is all the way here. Do you see? Next. I want to show that hand is useless. He can't use the hand. Next. This is when he got a Nobel Prize. Next. And he's in the wheelchair. And your queen is giving the Nobel Prize. Next. Okay, so now I will show you the film of Senator Kirk and my patient Kai from Oland, who organized the workshop last 2 weeks. Now here I have made a comparison of Senator Kirk. I took all the pictures from the internet. And here is Kai Virtanen, he is from Oland, Finland. And I have been looking after him. Is it okay? Sit down and talk. Is it okay?
Yes.
Yes. Because my knee will get swollen at the end. Thank you. Okay. Senator Kirk suffered ischemic stroke on the right side of the brain on 21st January, followed by surgery on 23rd January 2012. And Kirk treated with contemporary method. Yes? In the rehabilitation. Kai from Finland suffered stroke due to subarachnoid hemorrhage in June 2012 and was operated to remove clot and suffered additional infarct on the right side of the brain while in the hospital. Kai was treated with Vasacon. Here is Senator on the left and here is Kai on the right. Senator Kirk in the hospital 5 months after stroke in May. So this is month of May, and this is not written by me, it's on the internet, the dates, May 2012. And he got a stroke in January. And here we are in January, imagine. Okay, Kai in the hospital in Finland after stroke in June 2012. I think even he was flown to Uppsala for treatment. Yeah, I know, from Åland, he had come by helicopter to Uppsala. Kai had surgery for subarachnoid hemorrhage. Additional new infarct occurred in the hospital. Next. Now here is Mr. Kirk. You see, he has got the all high-tech equipment. He's been held by the corset and he's walking on the treadmill with special splint on the leg. Do you see that his leg is having kind of a robotic equipment? You see that on this side? And Kai has been brought on the floor. He has still the bag for the urine and he's paralyzed on the left side. So Kai came home from the hospital for 2 hours to avoid walking with the flail knee that gave recurvatum. He walked instead on the paretic trunk and shoulder, which was a what I mean to say here that he was a very clever man. So he told the rehab hospital doctors that he needs to go home every day for 2 hours. So from rehab center he would come home and his wife and his daughter-in-law, they are working on him. 2 hours they would, because in the hospital they were not allowing him to work with Vasa concept. So, and he wanted to practice that because there were kind of lot of people kept to keep an eye on him, what he was doing. And then the big doctors, the chief doctor was reported. So they were like banning him not to practice Vasa concept there. So he said, okay, let's go home and do what I want to do. So that's what he did. Next. You see, he's been given also the shoulder sling because he has a shoulder subluxation. And he also has developed the shoulder hand syndrome. Nobody could touch his hand. Even if you touch little, he would just shout and yell that I have so much pain. So you see the hand is swollen compared to the right hand. Painful shoulder subluxation with swollen wrist and finger and sling for the shoulder support. Now what we started doing with him is that we started to generate ground reaction forces to approximate the shoulder to reduce the subluxation. When you put the patient in this position like that, then the ground reaction forces are generated which approximates the humeral into the head. The head of the humerus, it goes into the glenoid cavity. And
Need a little translation? No? Okay.
I think everybody understands
Yeah.
good English. Even she
Yeah,
understands.
About the
Överarmen.
ground reaction forces.
Ja, ja.
About the ground reaction, I think
Mm.
if I drop the ball here, it will come back
Mm.
because of the ground reaction force that the ball bounces back. But if I drop something like that, it won't come back because the ground reaction force is not good enough and it is spread. If you have a ball, then it is at one point. So it will, the forces are collected at the point to bounce back.
Kallas golvreaktionskrafter på svenska.
So it supports the head into the socket actively so that the sling can be removed for good, and pain can be relieved by relieving stretch on the free nerve endings of the shoulder capsule. What I mean to say that when your shoulder goes down from the glenoid, then the capsule has a lot of nerve endings which are open, C fibers. So when they get pulled from the capsule of the shoulder joint, it gives you pain. So to relieve that pain, you have to generate the ground reaction forces which will relieve your shoulder pain. Next. Now here again Mr. Kirk, that world's most modern high-tech therapy received by Senator Mark Kirk 5 months post-stroke in May 2012. He also has got the oxygen mask if you see it. Yeah? And the wheelchair is kept behind because they are afraid that he might fall. And then you see how he's walking, he's got a tripod, and if you see, this is so typical, and he's left-sided, so what he does, if you see, he takes all the weight on the stick and on the right leg, and you see how he picks up the leg? Like that, the left leg. So normally, you and me, when we walk, we don't hike our pelvis. But because in his case, the leg becomes like a log, and the hip and the pelvis, they fuse. And that's why when he walks, he will do this. So despite treatment in the hospital, he does this, and we are not bothered about it because we think that's normal. So this is actually a compensatory movement, and we think, oh, that's the way it is. Every patient who walks like that. And here it is a guy who is, after 3 months, practicing to stand on that. Even you will practice from tomorrow, that you will stand on the left leg and your right leg will go front and back and front and back, and you have very good leg. I saw you walking. So in 3 months he's practicing this to take weight on the left leg, and he had already started developing the knee recurvatum. You understand what I mean by knee recurvatum, Mr. Khan? So we had to ask him to keep the knee bent so that the recurvatum goes. Otherwise, he had a strong knee recurvatum. And if you have that strong knee recurvatum, in the time to come, that knee joint becomes bad, and then they have a problem because of the pain, long distance walking. So then they get limited within home.
Vad är recurvatum? Det är översträckning av knät. Istället för att när man går så står man bakåt.
Next. This is in Aura, where his son came, and I was on a holiday also in Aura. So they came from Finland to Aura is in Sweden, north in the mountains. So me and my husband were on a holiday, so they took that opportunity to see me in Aura, and his son is working. And here I asked him to walk with the knee bent, and do you see how beautifully the hamstrings are working? Yeah, and he practiced because of the recurvatum. We had to make him walk with the knee bent, and he was loading his left hand. Next, we have only half an hour. Okay. So you see, then he started doing these exercises. I call it as a dog cobra exercise. Where do you see his wife is helping him in all the three pictures to hold the elbow? Because he couldn't control his own elbow. He would just collapse there. Now, the next one, he will surprise you all. Kai in the basic postures of Vasa concept, still his wife is helping. This is what is another belief or the concept in Vasa concept, is to empower the patient. I empower my patient that you learn, and you can work on your own about 3 to 4 hours at home whenever you are possible at least. But on the daily basis, you can at least practice 2 hours morning, evening. Next. So he is in the basic posture, and now here is Kirk. After 6 months, I think this is still on, the oxygen, and he has got the splint on, and he's walking in the hospital where he's still hiking the leg. And here is Kai in September, after 2 months, standing on the left paretic leg, and right leg on the rock, he's balancing himself. So you see his right leg, which is a good leg, is not supporting him anymore. And he's supporting himself on his left leg. Next. Senator Kirk is walking on the treadmill using tripod. You see the tripod is still there. Next. He's doing all the high-tech exercises. July 26th, improving walking speed. So speed matters, but actually it is wrong to talk about speed, because you can compensate and walk faster rather than use your paralyzed side of the body. So walking fast is a goal, but patients who is very clever, they will begin to compensate more and more. Yeah? Next. So Kai starts controlling his center of mass in various basic postures of Vasa concept. Now what I mean to say center of mass is that this chair also has its center of mass, and it is stable because it is on 4 legs. But I take away, and now it is on 2 legs. That means I have destabilized the center of mass of the chair. So if I leave it, it's going to fall. Similarly, in our human body, we have a center of mass, and brain of human body is constantly trying to protect the center of mass, especially when one has a stroke, because half side of the body, muscles, motors are not working anymore. So you have only muscle motors on one side. So the brain becomes defensive, like in this case of the chair, where it's going to be falling. So it needs my power to hold it from falling. Next. Kai starts controlling his center of mass in various basic postures. Next. Yeah. This is an inclined slope where if any patient has a foot drop, you don't need to wear a splint, but you can train the patient on the inclined board He stands with paralyzed leg on the inclined board.